A little bit about mitral insufficiency. So yes, we're going to talk a little bit about mitral insufficiency, and it does include mitral valve prolapse. So the MVP, yeah. Um, what is the mitral insufficiency? So basically, guys, it's quite simple. It's quite simple. Mitral insufficiency is any sort of regurgitation that refers to the blood from the left ventricle to leads to the leakage of blood from the left ventricle to the left atrium due to the incomplete closure of the mitral valve. So what is the causes of mitral regurgitation? Well, the causes are pretty simple to learn. All you need to do is remember there being an MRI. Okay, so for mitral regurgitation, we don't really use an MRI, but just for imagination's sake, just for thinking about it, let's just talk about this. So MRI, the primary cause is going to be MVP, mitral valve prolapse. They can be mitral annular calcification. They can be rupture of the chordae tendineae, and they can be rheumatic fever and infective endocarditis. And the secondary causes is going to be due to some sort of coronary artery disease. So the coronary artery disease is going to be prior to MI, causing pulmonary muscle involvement, and it's going to be maybe some sort of dilatation, cardiomyopathy, or left-sided heart failure, left ventricular dilatation, and mitral valve annulus open. What is the pathology of mitral insufficiency? Mitral insufficiency is basically the backflow of blood from the left ventricle to the left atrium, which causes increased pressure in the left atrium, and that causes left atrium dilatation and increased blood flow in the pulmonary circulation and pulmonary edema. What is the clinical features of mitral insufficiency? So the clinical features are quite simple. There's acute and there's chronic clinical features of mitral insufficiency. So the acute features are going to be some sort of pulmonary edema, some sort of left heart failure, some cardiogenic shock, and the chronic features are going to be maybe some sort of dyspnea, some sort of dry cough, palpitations, some left-sided heart failure. What is going to be the diagnosis of mitral insufficiency? Well, the diagnosis is going to be very, very simple. We get a stethoscope and we put it on the apex of the heart, and we're going to hopefully hear a systolic murmur, loudest at the apex, and there's going to be increased intensity when patients are going to be squatting, hand grip, or passive leg raise. So you might be wondering, why the increased intensity? Well, basically what happens when we squat? When we squat, we're basically going to be increasing preload. So by increasing preload, what happens is that it would increase the amount of blood in the heart. And when the blood in the heart is going to be much more, it's going to be basically leading to our heart now no longer, the valves will no longer be touching each other no longer. And when the valves will no longer touch each other, the murmur will be quite reduced. So over here I kind of have like a photo which I found on the Google Images, which kind of shows squatting, which shows Valsalva maneuver. And Valsalva maneuver, basically what happens is that that there is going to be maybe increased amount of vasoconstriction, and that would lead to a decreased amount of blood in the heart. But in squatting, because we're kind of compressing the veins and kind of getting all the blood back to the heart, it's going to lead to a decreased amount of the murmur. We can see ECG. ECG is going to be the P mitrale. It's going to be biphasic, and we're going to see P pulmonale, which is going to be more than 0.25 millivolts, and we can even see valve abnormalities. So now, what is the treatment of mitral insufficiency? Mitral insufficiency is going to be due to the fact that there's going to be some sort of hemodynamic. Is going to be our main goal will be to do hemodynamic stabilization, stabilize the patient, stabilize his blood pressure, stabilize his heart rate, stabilize all of that stuff. And then the next thing is going to be some sort of intra-aortic balloon pump. And over here we're just going to go in using a balloon, kind of fix the valve, and we're going to do a quick valve repair. In addition to that, if his ejection fraction is above 30%, we would do repairment of the valve. If less, then we would also do a repairment of the valve. So it really depends if he's symptomatic. So chronic, just kind of repair the valve or kind of replace the valve. What are the complications of mitral insufficiency? Mitral insufficiency, the complications are going to be done with this mnemonic called CAPE. CAPE, it will be like some sort of cardiac failure, A as an AFib, P as in pulmonary edema, and E as the endocarditis. So these are the 5 main complications of mitral insufficiency. So guys, you know it's the main MVP. We know it's very simple, leads to regurg of blood. We know that it's an MRI. You want to know the causes? Just know an MRI. Mitral prolapse, infective endocarditis, and rheumatic fever, main ones. And blood is going to be regurg. Acute and chronic symptoms: heart failure, pulmonary edema. We can have dry cough and whatnot. Diagnosis is going to be with auscultation, with ECG and echo abnormalities. Treatment just kind of replace the valve, and then what are the complications? CAPE, cardiac failure, AFib, pulmonary edema, and endocarditis. Hope you guys found this video useful, and thank you guys for watching.